FUE Max, my preferred technique, and why is it the best one? Hi, I am Doctor Arvind Poswal from Dr. A's Clinic, Delhi, India. And today I'll be helping you understand which technique to use for your hair transplant so that you can get the best results. There are some very fine points which you need to understand. First of all, when you are searching for a hair transplant doctor or a center, remember you are searching for the end result. Focus on that. And how will you focus on that? By seeing a lot of results. Check out 100 results, 200 results, 300 results. Look for anything unnatural. Also look for Photoshop. Many a times I find some unethical people doing Photoshop on these results. Don't fall for that. If you look carefully, you will always be able to make out. So now we come to the technique. Remember, there were two basic techniques. One was that strip where we take out a piece of skin from the back of your head and then we stitch it up. That was FUT. We are not going to talk about that. But what we will talk about is different methods of FUE. FUE is taking out grafts one by one for use in transplanting. Now the technique which I use is called FUE Max. Max because we give the maximum care to your grafts. We give them the maximum nourishment also, and we give them the best scientific solution. So how do we do that and why I prefer this method? So in first step, when we take out grafts or anyone takes out grafts for transplanting, it should only be from the permanent safe donor area. Now what is permanent safe donor area? Permanent safe donor area is only this much. That part of the head on back and side of your head where no one in your family, no matter how bald he is, has lost hair. So that is just a U-shaped point going here like this. So get that area marked before your procedure starts. When you come to me, I always mark that area. That see, this is the area, look here. So you will also be able to look, yes, this point no one has lost in my family. So what happens, benefit is, once we transplant those hair, then those hair will keep on growing for the rest of your life without need of any maintenance, without need of any PRP, without need of any finasteride or any harmful medicines. These transplanted hair will grow for life. I've been doing this thing for 26 years now, and my results are all over the net and also on my photo gallery. And I share those results online for worldwide discussion also. So if you need proof, you just have to see and you will find results right from 2005 also. And you can see very clearly. You can see the hairline and you can see each hair growing. So that technique allows for the long-term growth, hair which remain for life. I have also come across instances. There was a famous company who they try to market their things by saying, okay, we'll just take the hair from here and put it here. That's not how it works. That's not science. That is not medical science and that is not surgery. Who does that? You don't take a kidney from one person and put it into the other. That's not how the way things are done. When we take out grafts, first we ensure that it is taken only from the safe donor area. Now there are some people who took out, in case of a very famous former Indian cricketer, those direct people who tried to push that, they took out hair from unsafe donor area, means from high up here. Now these hair are not permanent. These hair will go. So what happened? After 2 years, 50% of those hair were lost. But what did you think happened? You thought that after transplant, most of the hair fall out after 2 years, which was not true. The correct thing was, if hair had been taken from the correct safe donor area, then they would not have been lost ever. So that is one problem. Now the second problem, we are not rushing through your transplant, we are not delaying it also, but each graft needs to be examined. We have to see that this is an intact graft, that there is no excess bad skin attached to it. We have to separate the single hair graft from the 2 hair and 3 hair graft. You can't have a 3 hair graft growing right in front, it will look so unnatural. Right? So we do that. Every good doctor in the world, the top 10 doctors in the world do that. They will never rush through your transplant by pulling a hair out from one place and putting it to another place. Right? So one is that. Then once the grafts are out, they are nourished in gene therapy serums. Those are antioxidants like resveratrol, grapeseed extract, and at a 4 degrees centigrade temperature, which allows those grafts to remain for a period of time. Even then, we do not delay your transplant. No doctor is going to delay. They are not going to take out today and tell you to come back tomorrow, we'll put it. No one does that. No one will also keep the grafts outside. Why should we? At least I don't think anyone should. We don't. So those are placed correctly, and then they are put into the slits. Now, putting into the slits, that is also part of this technique. We make all the slits at one go. I make all of them, like in a patient when I am doing, all will be made at one go, because I am the artist who is doing the procedure. I know the direction, I know the angle that the hair has to be. I know the density that I want. So I make all those slits, and then the grafts, which we hold only from the top. Remember, we will never hold a graft from the bottom, never from its root. That is called no root touch technique. Then you hold the graft from top, open the slit and gently slide it into the recipient slit. That way the graft gets the best and the safest transport from the place where it is taken to the place where it is put. Third, never use an implanter. I never use an implanter. And I know the best doctors in the world will never touch an implanter. Implanters were made by Chinese doctors, and there was a reason for it. It was almost 25-30 years ago. Chinese have very thick caliber hair. So maybe it could help in their case. But for most other people, implanters are a harmful thing. Why? Imagine there is a needle and you are putting the graft, all of it, from the root to the top on that metal piece. And then you are pushing it into the skin. Have you ever seen a gardener planting? He will always hold the plant from the top. He will never touch the root. He will never put the plant in a tube and try to force it into the earth. So why would any doctor try to do that on your hair?